Now it feels just quick. That's the last of everything for me. Yeah, we don't have anything else. We just have an exam. And I think the shoes also, huh? Yeah, Tuesday. I'm teaching computer, what do you call it, office management. I'll be teaching office management. Yeah. I prefer science, but the hours, but anyway, the hours, it's all good. Okay, so, huh? We're recording. We're ready. Our last lecture. The funny thing is, go ahead. Thank you. Is that when I got hired here, when I got to the interview here, so usually you have to do a teaching interview. You know, they interview you and then you have to teach something. And the subject that they chose for me was infection control and radiology. So, yep, yes, yeah. I mean, we have a committee that, huh? No, no. They'll just tell you, well, do a lecture on this subject. So they will be more fair. So everyone is presenting on the same subject, I guess. And then you have to prepare it and then present it in the way that you like it. Huh? No, I did a different one. You know, for a teaching here, you know, you have to put everything on the slides. Like the other one, I was just playing with the other one. I saw it. So the other one has more just pictures and I just talk about things, which I cannot really do here because you guys, you know, rely on this to really get the information. Yeah. But some of the pictures are from actually that lecture. So next week, technically, we only have Tuesday so far. Yeah, yeah. Thursday might not. We might not have anything. If Miss Jukes is done, then you're good. You're done. Yes. Tuesday, yeah, and Tuesday we have radiology as well. Yeah. Not sure if this is going to record. But anyways. So as I was saying, today our lecture is about infection control and radiology, and I think you guys kind of know everything in here. So it's a small lecture. We'll talk about a few things, which most probably, again, you're already doing in the lab, and let's get going. So, first of all, infection control radiology. I see that's what infection. Okay, is important as important in radiology as in other field, right? Anything that we do in dentistry, we know that it has to be. One main challenge with X-rays, or three challenges maybe with the radiology. Well, the challenge is with the film, mainly with the film. But why the film is the challenge? Why it's different from almost any of the other instruments that we use? Because what? It goes in the tiny mouth. Inside of the mouth. Well, we have instruments that go inside of the mouth, but the cord, okay. Disinfectants. So the issue is that we cannot sterilize it, right? We cannot put it in an autoclave and sterilize it. We have to rely almost 100, well, 100% on our barriers and our infection control techniques, right? Because we cannot put a film, whether it was the phosphorus plates or the the wired sensors, in the autoclave, and most of them also would not be able to disinfect them with high level disinfectants that are strong. We cannot keep them immersed in there to get the actual sterilization. So that's kind of one problem with that, or the issues with that. So they are reusable, right? We reuse them, but they are Huh? Heat intolerant, right? And they're sensitive to chemical disinfectants. Exactly. So that's a problem with them. That's an issue. And that's why doing the things correctly, the infection control sequence or practice correctly with the X-rays, taking X-rays and the procedure is very important for us. Well, there are some disinfectant solutions for them. They sell specific ones, but they're not as the higher level as we want them. I mean, we try our best. We can disinfect them, and that's it. And then we cover them for the next patient. I mean, there's no really, yeah, there's no, and I don't think I mentioned it, but the studies say that about 50% of them, I think they let students try it, or dental students. I was reading like a study, and they were saying like they asked them to put the covers on and put them on the holder, and then they found that 50% of the time we have some compromise of the barriers. Either they will be like torn, or opened, or something like, because at the end of the day they're just plastic and the patient might bite on them. You might bend on them, all these kind of things. So they're not as much as we want to do it, but again, they're not as perfect solution for what we need. Anyway, and that's why we're going to talk about these things. So when we think about the infection control, when we expose, we think about it in 3 stages. Prior to exposure, what do we do? And then during the exposure, what do we do? And then after the exposure, what do we do? Again, all of that to keep the infection control. So some fundamentals about infection control. There are a lot of more about this in the chapter, but again, we already covered this in other classes, smiley face. So I don't want to go through all of this with you guys. I'm sure you already covered it in chair side as well, even more in depth, right? And then we did talk about it the other day with dental science. So we don't need to go through this again. But generally, we know the chain of infection, all of these parts, and we know that our goal is to break at least one of the chain to be able to break down the infection, right? So thinking about that, that's what we need to do. Other things, just to make sure we're all on the same page. The EPA, which is the Environmental Protection Agency, I think, right, would classify the chemicals that we use to disinfect into 3 levels. You have low level, intermediate, and high. So the low level is called non-tuberculoside, so it doesn't kill the tuberculosis disease. The other one is the intermediate, and that is considered as a hospital grade with tuberculoside properties, and it will work on non-critical equipment. With critical equipments and non-critical equipments and all that? Yes? No? We have a slide for that. And we'll see, yeah. And again, that's why I wanted to put these in here, just to make sure we're on the same, because we'll mention a little bit about these as we go forward. So, yeah, critical, semi-critical, exactly. And then we'll see how these would apply to radiology as well. So, the non-critical equipment. So this would work with non-critical equipments. And for us in radiology, the non-critical equipments are tube head and PID, okay? The high-level disinfectant, right? They work with semi-critical that are heat sensitive. Again, we'll know more about this, I think, in the next slide, what are semi-critical, non-critical mean. So again, we know the difference between disinfecting and sterilization, right? Yeah, so disinfecting, killing almost all of the bacteria, right? Most of them, let's say 99%, but they would not kill the spores, right? And that's why we do the sterilization and the autoclave, because the autoclave kills the spores and we get everything. With the high level disinfectant solutions or chemicals, we can actually get sterilization grade of disinfecting if we let it in long contact with the materials. So if we put any material or any equipment in a high level disinfectant solution for about 10 hours to 12 hours, they usually will be sterilized. They can actually kill the spores, but again, they require much longer time. And that's why, again, we don't use it. We used to have, a lot of offices used to have what they call cold sterile. Do you guys know about that? Talk. Yes, and the sterilization part. So they used to have the called the cold sterile, which is they use, I think, glutaraldehyde, if I'm not wrong. And you put it in a holding bath similar to the one that we have, and we put the instruments that are heat sensitive. So they used to put like the X-ray rings, and some people used to put the disposable impression trays. The disposable impression trays that we use for alginate. Some offices might reuse them by putting them in the cold sterile for 24 hours or 12 hours, and they come wash them up and they reuse them because they're heat sensitive. You cannot put them in the autoclave, but you can put them in the cold sterile. Anyway, so a cold sterile, which is similar to what we're talking about here, if you have a high level disinfectant and you put it for long contact with the thing, it can sterilize it. And again, this raises an issue with X-ray, especially again here we're talking about digital X-ray, not the film. But in the film, I put the digital X-ray and soak them in for 12 hours, right? In these to get the sterilization, and that's why again that's the issue that we have with the X-ray sensors is that we cannot really sterilize them all the way to the end where we can disinfect them maybe, but not really sterilize them. So most sensors, the manufacturers would not recommend to be disinfected with this level of disinfectant. So they would not recommend to use, for example, Cavicide. Cavicide is one of these. If you've seen them, right? Sometimes I think Dr. Spini uses that. It's like a Cavi wipe that is used in dental offices that is really high level disinfectant. They call them Cavicides. A lot of offices use it to wipe the chairs, when they're done with the work. So a lot of or most of the manufacturers for the sensors, for the X-ray sensors, they will not recommend that you wipe it with Cavicide. So again, we're just having these issues with thing. Okay. So again, continuing about some fundamentals about the infection control. So if we want to classify or to put some definitions for the object risk of transmitting infection, technically the materials that we use, we have technically three main categories. We have critical, non-critical, or semi-critical, and non-critical. So the definitions are here. Plank are the instruments, equipment, things that come in contact with the skin. Non-critical, right? And then blank are penetrating soft tissue or bone. Critical, right? So, for example, an example for critical instruments that we use. Explorer, right? Exactly. Um, a scaler, right? Huh? The perioprobe, maybe the syringe, right? These things that actually can have blood on them, right? They're actually pinch or they go through the skin, they go through the soft tissue inside of the mouth. But for example, and the last one is semi-critical here, right? So come in contact with the oral mucosa without penetrating it. That is, for example, what? Mouth mirror, right? Maybe the conroll pliers, anything that doesn't kind of have a sharp edge that go into and pinch, go through, penetrate the soft skin. So if we are talking here about radiology, we have all these things that are related to radiology. Think where they would fall under for a minute or two. Try to figure that out, and then we'll do that together. Bless you, bless you. You can copy and paste, definitely. Right. So, let's see here. Let's make this much more bigger and make it bigger. Okay. Okay. So, what do we think about the image receptor positioner? Semi, right? Because it goes in contact with the mucosa, but it does not penetrate it. Okay. How about the X-ray tube head? None, right? Because it does not even come in contact. You know, it might come in contact with some skin, but not. It's not critical. I mean, that does not mean it does not get infected, because it still can get some of the uh, globules, or what do you call these, aerosols infection, but mostly it's not critical still. So, how about the supporting arm of the X-ray unit? Non-critical, right? Still, it's not touching any mucosa inside of the mouth of the patient. How about the extraoral positioner? Do you have all non-critical here? Non-critical. I guess they don't fit in here well. So let's see what else. The PSP plate guides. No, that's not the. Oh, the extraoral positioner guide. I guess I didn't copy this together. Non-critical. Let's see. How about the PSP plate? You guys are asleep? semi Semi critical, right? How about the digital sensor? Semi, right? Still. And then the panoramic bite block, semi, right? Because they bite on that. And then the lead apron and thyroid collar, not critical, right? So we don't have any critical instruments or equipment in radiology. Oh, the PID here, yeah, non-critical. Look what we have here. So, yeah, I like the spaceship, right? What do you call that game? Huh? Galaga? It's called something like that. Yeah. Bless you. Here. Something that's shooting back at her. Right? Okay, we're good with this? All good? Yes. Semi-critical, non-critical. Got all the information that we need. Let's move on. So, also some of these other parts of the object risk, transmission, infection. We also have the clinical contact surface and the housekeeping surfaces. So again, just to know that, like for example, a part of the X-ray things that we work with is the control panel, and definitely the treatment room counter. That is considered as clinical contact surface. So it's a contact surface that doesn't come in contact with the patient directly, right? But it's within the things that we use. So we might touch directly or indirectly with our fingers or our hand, or put an instrument on it, right? So these are things that can be also. And then we have the housekeeping surfaces. These are the directly involved, but something outside, maybe the sink when you wash your hands, or any other surfaces where you might put, for example, other instruments. So anyway, these are parts of the terms that most probably you already know with the infection control. So prior to exposure, now we're talking about the steps technically prior, during exposure, and after exposure. So we're starting with prior to exposure. What do we need to do? Definitely, we have to get the PPE, all of our PPE that is necessary. We have to clean, disinfect, and put barriers on surfaces. These would include, but not limited to, the patient chair, the X-ray machine, medical surfaces, the keyboard and mouse, right? That's something that to think about, especially we're using all digital here, and most offices would use that. So you will have to interact with the mouse and keyboard, and not just to think about the mouse with keyboard. I mean, you're going to cover them, but what about the surface that the mouse and keyboards are on, right? You have to also make sure that you're cleaning that surface afterwards, or have a cover or something on it. We have to get all of the necessary supplies like the image receptors, the holding devices, the lead apron, paper tissue for the patient, disposable cups sometimes, maybe cotton rolls, and some, if you want to, easy access to the, make a place for easy access to this will have easy access to these, so you don't have to open any drawers or anything while you're working, right? Technically, this is called a unit dosing. Have you guys heard about this term? No, unit dosing. So technically, like, you put out and get out all of the things that you need for that specific procedure, so you don't have to go out of the operatory room, or you don't have to, reach out for anything other than the ones that you already set up. That's called a unit dosing. Okay, and that's like a what do you call it? It's not just a term, but it's a concept in dentistry and infection control. Again, to make sure that we do not compromise any other spaces and any other surfaces that we do not need to, by getting all of the things that we need for that specific procedure. And so we stay in the same room and we work there. Okay, so we're still in the prior to exposure. For the PSP plates, for phosphorus plates, we have to use plastic barrier envelopes. I know you guys didn't work with these yet, right? But technically, again, they come in a, that's how they are. It's just like a thin, kind of, let's say, plastic-ish layer. It is thin, but again, this is the actual thing that the computer would read, and we have to cover it with this envelope. So they sell these disposable envelopes that you see there, and then we put this film inside of it, and then we seal it. The small envelopes, again, is the size of the film, 2 or 0 or whatever, and then you put them in there, and you need to prepare before you put it inside patient mouth. So we know for the film, the sensor, the wired sensor, we have to put the sleeve, right, into it. So this is similar to the sleeve with the ones that are phosphorus plates, okay? And this is technically similar to what the film have, the regular film. The regular film has the outside, what do you call, barrier, right? Plastic barrier. And then inside there is a paper. So some of them even have papers in here. Anyway, so you have to prepare that. And that's another issue why people are getting away from using the phosphorus plates, because there are a little bit more preparation that needs to be done, and then processing that needs to be done. Anyway, keep a plastic or disposable cup for contaminated films. So if you're using phosphorus plates, you put each one inside the patient mouth. We know, because we cannot do the same film and keep exposing it, because it's not direct contact connected to the computer. So you expose a film, and then you put it in a disposable cup for contaminated films. Well, you have to wipe it and then place it in there. So you have like a cup for all of the contaminated films, so you can take that with you outside of the room and then be able to work with it. With the wired sensors, we know we have to put the sheath or the sleeve or whatever you call it, and blank can be used for a better fit. And that blank is this thing. Have you seen, I showed some of you, I think, when we start talking about the composite. It's something that is like a finger out of the glove, right? And it's a finger cot. They call it a finger cot. So it is a finger out of glove, technically. I mean, they sell it separately like that. And uh, and you put it, usually you put it on the curing light. So you can put it on the curing light tip to cover it so it doesn't come in contact with the patient. So instead of putting the whole cover for that, they might put only this. Okay. Well, I've I've seen them like that. I don't know. Yeah. So what happened here is they found that it's better to use a finger caught with the sleeve to make sure you're putting a better infection control. You're practicing better infection control procedure. Because again, this kind of holds it up and closes it so it's not loose anymore. So yeah, that's an extra layer of protection where you're using the wired sensors. Okay. So other notes here about, oops, other notes. So you want to follow the manufacturer recommendation for the infection control procedures for each type of, excuse me, sensor. And then, as I said, barriers can always tear and not always totally protective. As I said again, one of the studies that I read says that about only 50% of them give complete protection. But other than that, again, you're working with it, putting it inside patient mouth, outside, it might cause some tears, and then you will have a compromised film. All good, guys? Yes, moving on. So patient preparation, again, that is all still prior to exposure. All the things that we have to do, you prepare the area, you provide an optional. Well, that's an extra thing. Yes, bib maybe, but something to disinfect their mouth. Yep. It's not that much offered, but again, why not, right? Because just like when we're taking uh, an impression, right? We ask the patient to do that when we're cleaning their mouth. So why not? It just adds another layer of protection. Um, but again, not a lot of people would offer that. And then we have to ask the patient to remove interfering objects. And you know what are these guys? Jewelry, right? Depending on the extra that you're taking, if it's extra oral, maybe glasses, intraoral, you might want to remove partial dentures, complete dentures. Um, what? For the, yeah, I mean, sometimes because no, because it can interfere with us seeing what's going on, right? It's all metal, especially these partial dentures that are metal, right? And then you give them the lead apron and the thyroid collar and give them some tissues and all of that. So again, you can see here, this patient, we gave them even an patient bib. And this is to protect what? Protecting what? The lead apron, right? The lead apron, because the lead apron is also a little bit harder to clean up. So why not give them that just in case? It will reduce the amount of things, because we put this on every patient. So it's a good move to, put that on just as an extra thing. All of this aerosol, that comes out of patient mouth, saliva that might fall in. So it's just better, an extra layer of protection. I was looking on a patient thing, and then I found this picture. found It's, I don't know, creepy or nice or right? And you see how small she is and all of that. So, yeah. Yeah, right. It's just like out of it is. I didn't find a better picture. It's a little bit smaller one, so yeah. But anyway, yeah. Now she'll turn. Take a good X-ray. Make all okay. Chucky, right? I don't want. I wanted to say Chucky, but then I said maybe you guys don't even know what Chucky is. Oh, okay. Well, that's good. I'm not that old. So during exposure, definitely. Now we're done with prior to exposure. We set up all kind of things, right? We covered all that. We're ready. So we want to touch only. Yeah. Okay. Covered surfaces, right? And touch as few surfaces as possible. So definitely when you work with I mean, you guys cover all of that, so that's good. And just make sure when you do any chair adjustments, if you're adjusting the chair rest or whatever, try only to touch the surfaces that are covered. Don't touch the lead apron. You might have also like what do you call these gloves? The huh? Cover gloves? What do you call it? Over gloves. Yes, the over gloves. You might have that in the room just in case you needed to reach out for something or touch something that is not covered. So why not? Place film holding devices on covered surfaces. So also you have to have surfaces in the room and on your counter that is covered with some tissues or something, so that again, because if you're using, for example, the rings or even the snap array and you know the bite block for the bite registration, and you're switching between these, so you need to put something down on somewhere. So you must have an area that is covered and ready for you to put things on. So always, again, keep that in mind. After exposure, this is not like the after exposure, the end result. This is just while we're doing the exposure, still during the exposure, but after each film, after each picture that we take, for the wired sensor, that we have the sleeve on, you want to wipe the plastic and reduce the saliva that is on it before you replace it in a different place. Again, these are best practices. Most probably no one does that. Yeah, you'll just move on to the next tooth, but it is preferred that you wipe off any extra saliva that is on the sleeve, just again to reduce a little bit of the infection that might happen. And then for the phosphorus plates, you place them in yep. And that disposable cup would be clean from the outside, so you don't want to touch it. You have to keep it clean on the outside. Again, some people might not place it in a cup. They might place it, like, for example, on uh, what do they call that? A tissue, a paper towel or something, and then they pick it with them. But it's better to have it maybe on a cup, so that after you're done, you can, hold the cup that is clean from the outside and use it, which we'll talk about in a little bit. So now we're done with the during exposure. We know exactly what to do. Again, you guys must probably already do that. Now, after exposure, and I wanted to ask you before I actually talk about this. So how do you take the film out without really contact? So you're done with your exposures, right? And you have that wired film inside of that thing. How do you take it out without touching it with dirty hands or gloves? What do you do? Huh? But with what? With bad gloves? With dirty gloves? With disinfected gloves? And then what? Where do you push it? And then how do you hold it? Huh? But the whole thing is dirty. The cover is dirty, right? So when you're holding the cover, your hands are dirty now. So that's what I'm asking. I'm asking what you guys do. So some of you are telling me, yeah. With a clean glove, you hold the wire, and then with dirty glove, you hold the cover, right? And then you take it out, and then you put it on somewhere that is clean, and then yeah, and then you change your glove. Yes, exactly. So it is, it's not easy to make sure you're doing that right, because again, if you're holding the wire, you have to hold the wire with clean hand, And then the other side, you're holding the cover, the sleeve with a dirty hand, right? So just like Alex was saying, maybe hold it with a clean hand on one side. Yeah, leave one dirty glove on, and then you. Yes, so that hand is now dirty. Exactly, that's what we were saying. And then put it down, and then, or some, there is a video that I can show you. They slide it off, but it and falls down on a like a sponge thing, so it doesn't get hurt. But you only with dirty gloves still, you just push it out a little bit by a little bit, and then it falls on a clean area, and then you change your gloves. So, I mean, you have to have a system. What I'm saying is just you have to make sure you have a system because you should not touch any part of the wire or the sensor with dirty gloves. So that's the issue with that only. But anyway, that's what we're talking about. So after the exposure, you want to remove your gloves, wash your hands, and then remove the lead apron, right? You should not remove the lead apron with dirty gloves. You have to wash your hands, remove your gloves, dry your hands, and then you do that. Remove any barriers that can, and then clean the surface, definitely. You can prepare the holder for sterilization. I mean, these steps afterwards, after removing this from the patient, it's swappable. So you might go and do maybe the patient is just still sitting in the same room. You don't have to remove the barriers and clean them up, right? Maybe you have a special room for x-ray, and then you have to remove the barriers. So this is just a general thing. We know that after the patient moves, then we have to do these things. And now we're talking about the wire sensor. This is what I was asking you about. So remove the barrier, carefully remove the barrier from the sheet, which can be either way, the way that you're doing it with, clean gloved hand and dirty gloved hand, and you swap it off. Or maybe just like this. Again, I saw that on one of the websites. So they're kind of pushing it. It's almost the same way. Most probably this hand should be clean. Yeah, because otherwise this would not work. And then again, there's a video that I have that they just push it out and make it fall on some area. Okay. Anyway, and then avoid tearing the plastic, right? Because if you tear the plastic, you'll contaminate the sensor. And again, we know these things are really tight, and sometimes it's hard not to rip them off, right? When you pull it off. So you have, again, to keep that in mind. Push the sensor until it falls on a cushioned and clean surface. So this is just the whole thing from the website. I mean, again, whichever way you do it is correct as long as you're keeping infection control measures correct, right? So this BiBlock is I think it's the glue one. It has like some kind of a glue into it, and it glues or holds the sensor into it by just the glue that it has. It doesn't have that elastic thing that we have with these ones. Anyway, so we still after exposure, if you're using the PSP plates, so remember we put a cover on them, right? We put an envelope on them when we were talking about setting them up. Here, that's that envelope. We put them in here, we seal them up, and then we use them. And now we're done, right? So you get the disposable cup in it, and then hold the film directly over the, what do you call this thing? Huh? A transfer box. I think we had that, right, in one of the slides in one of the lectures before. Maybe the last lecture about the thing. Yeah, that's the transfer box. So it's just a black box that have some kind of, it's not sponge. It has some kind of, again, like material that look like sponge or act like sponge. Anyway, so it doesn't hurt the film. So when you take them off, what you need to do is to tear them off without touching the film. So you hold it from either side. And again, I understand doing it with your hands will make a lot of more sense, and you understand exactly what I'm talking about here. But I tried to make it as clear as possible. So you hold it and you tear it off, and you get the film to fall by itself on the transfer box. And then try again to make the side of the film that is light sensitive facing down, right? Because this PSP film is light sensitive. So once you take it out and you put it on transfer, if light hit it, it can affect the x-ray that it has. Okay? Anyway. Do not touch the plate with gloves hands, dispose of extra items, and then you process the film. So this was for the phosphorus plate. And boom, we are done with our lectures. I'm going to go home. Bye-bye. I know. I have an exam. I have to be on the exam. Yes. I think so. I don't know. He's so happy. Oh yeah, exactly. And then here he's just running. Yeah.